Well, hello, greetings, PSMA member organizations, including practice administrators, clinicians, as well as some physicians I see that have dialed in as well today. We certainly thank you for your valuable time because we know the challenges of running a healthcare practice. Your time is really important to us. Obviously, the interest in this webinar appears to directly speak to the importance of this topic, providing an alternative to the rising cost of traditional health insurance and its direct impact on PSMA members. By way of introduction, my name is Jim Fasone. I'm with USI, an organization committed to supporting healthcare organizations, particularly physician practices, and providing unique solutions to help their business thrive. So for this webinar, logistically, we're going to hold all questions till the end of the presentation. And then you'll see with your prompt there's a chat line that you can type in your questions. And at the end of the webinar, I'll read those questions off and hand them off to our panelists. Over the years, I've been really fortunate to have a long relationship with Tim Lescali, co-founder of your group purchasing organization, PSMA Connect. And we've been working now for quite a while to identify issues for the members, and we're really excited to bring this unique offering to a difficult challenge facing PSMA members. So with that, I'd like to introduce Tim to provide some introductory remarks before I introduce our other two speakers from HealthShare Fit. Tim?
Well, thank you, Jim. PSMA has been in business now for 20 years, looking out for our membership, healthcare facilities across the country. PSMA is now, membership reaches over about 20,000 physician practices across the country. So you're part of a good sized organization that's here to look out after your interests. We had been searching for an alternative, as Jim had been talking about, to the rising healthcare cost and trying to find a solution for our members. It's one of the things that members have been asking us for several years. And in our research, we came across the HealthShare program. Jim and I were actually vetting it and doing research and seeing, how it looked and how it worked. And during that time, we had a personal experience where our group planned with a large insurance company, not to be named, but after 20 years of paying premiums, they canceled our small group policy with no notice and for no reason other than they didn't want to offer it anymore. Our premiums, they sent us to the exchange, and our premiums, which had already gone up by 40 to 50% over the last few years, were about to go up by another 30%. So we were looking at HealthShare for our members, but we decided that this was a good opportunity for us to try it out personally. And my family is now a HealthShare member. Our premiums are 70% less. Our monthly share is 70% less than what we were paying before. And our benefit, what we get from the program is equal, and in fact, in some ways, better. So this turned out to be perfect timing, and we are very excited about presenting this option for our healthcare members to take care of not only your personal healthcare needs, but that of your families, staff and employees, and workers. So Jim, I appreciate the time, and we appreciate you joining us today and taking a look at the HealthShare plan.
Well, thank you, Tim, for your comments. And it is interesting that while we were looking at this option for your member physician practices, that you had your own personal issue with your business, and fortunately we'd already vetted HealthShare and you became a member quickly. So that's a wonderful story. So now I'd like to turn over the bulk of the presentation to both Sandy Elsas, co-founder of HealthShare, and Carrie Romano, who's a critical care nurse with HealthShare, for them to talk about the benefits and the features and how it works. So Sandy?
Thank you, Jim. As an aside, Jim and I have known each other for several years, wandering around the various healthcare insurance space. So we've known each other to the point where we both trust everything that we're doing. So that's a good start. And we've met Tim now a couple times, and that's also very helpful. I'd like to turn it over to Carrie Romano, who's going to address several of the issues that are involved and how this works. And I will periodically jump in to throw my 2 cents into the mix as the co-founder of the Health Share Plan.
Hello, thank you, Sandy, for the introduction. I would like to discuss how the Health Share Plan is better. The Health Share Plan is the result of the decades of experience in healthcare and risk management. Our non-insurance community is centered on a commitment to healthy living and sharing the costs of medical care. We provide high-end care for members and their families at a more affordable price than conventional insurance. That is why we feel that we are truly different and better. Your providers are also paid more, and they do not need to deal with any hassles of billing a traditional insurance company, and it makes them much happier. And as the members will realize when they call to make appointments, they get bumped to the top of the line. So how the Health Share Plan works. Members pay a fixed amount per month to participate in the sharing network. When an individual has a medical need, the Health Share community steps in to ensure they are taken care of. Now, the definition of a need is one or more medical expenses caused by a single accident or illness. This could be either a broken leg or an ear infection. Now, my family is also members of the Health Share Plan, and we recently had an incident with my husband who needed to see a cardiologist. We went to see a top cardiologist in Manhattan, had a 3-hour exam resulting in $3,500 bill. We paid $500 initial IUA. We will discuss what IUA means shortly. And we had the whole workup done. We submitted that need form with the receipt that we paid the $500 IUA. Plus, we were required to see 2 other doctors related to that one incident, a pulmonologist and the internist, just to keep him on board with everything that we were doing. And all of those visits were included because it was related to the one need or visit that my husband had. So we only paid the $500, and the paperwork was very simple to do. Initial IUA. This can be viewed as sharing a piece of a pie. The members pay their initial pie or need. This is either $500 or $1,000. This is the member's choice that they make upon enrollment. Then the cost of addressing up to 3 medical needs, 5 needs when a family is participating, are shared amongst the community.
Okay, what's the difference between a traditional health insurance plan and the Health Share Plan? Well, commercial insurance, it's basically they're covering everybody for everything. And we are serving the sharing community. So if you sign up with us, you will join SHMI.fit, and that's an association, a nonprofit that becomes a common thread for all members of the Health Share Plan. And as opposed to your normal bureaucracy of trying to find somebody to talk to, we have people that you can talk to who will talk to you in person, over the phone. And when we get to explaining our partnership with Sedera, we'll explain that even further. So what are the restrictions on a normal traditional insurance company? Is you've got to see the network doctors or pay extra. You need pre-authorizations required. And I don't have to explain to anybody on this call the aggravation factor of dealing with these gigantic monolithic companies. With us, we do have some preconditions that are not shareable. They are the big ones. If you have recently had a heart attack, a stroke, you have cancer, and you have hemophilia, I can't remember the phrase. Anyway, But you can also get around that if they're cured. So if you're going to have elective surgery, we want you to have a second opinion. But otherwise, we're easier to deal with. The health sharing community has actually been around since Ben Franklin, going all the way back. But recently, the last 25 years, religious organizations banded together and went to Congress and said, we want to be exempt from all of these crazy rules that you have for health insurance. And the Congress said, yes, we are not affiliated with any religious organization. We are affiliated only with our members as a independent contractor, part-time employee, can be an employee, or can be very entrepreneurial, or a franchisee. And of course, you can see the results there is that Sedera's got 1.5 million people on their platform, and they've paid out over $1 billion in the last 25 years. Sedera gets on average a rate reduction of about 53% of what is billed of the medical needs. And obviously, you don't need to be good with math to figure out if they cut what the bills are in half, it becomes that's one of the reasons why our costs are so less.
So just some fundamental differences with traditional insurance companies. The insurer is on top, and then you have the patients and the physicians. You pay a monthly premium. You select a network physician and a network hospital. You pay for out-of-pocket network, you pay a co-payment, deductible, and co-insurances, and you should always expect to get balance billed. Now with the health share plan, we're facilitators. The patients work with the physicians. They try to talk to them. They tell them that they're considered a self-pay patient, and they actually get discounts on their bills. They pay a monthly contribution. They have a choice of physicians and hospitals. You pay up to the initial IUA, and then you submit a need form for any additional bills that may be due. The result, freedom from networks. This is really big, especially if you have an insurance plan where you cannot leave the state. Just a simple example, a couple of years ago, I had a medical emergency. I live in Mahwah, New Jersey, which borders New York by 5 minutes. My husband took me to the nearest emergency room 5 minutes away in Suffern, New York, and I got billed for everything, the hospital stay, the emergency room visit, and everything in between, because I left the state of New Jersey. So this is a big one. We have no co-payments or co-insurance, no lifetime maximum on medical care or pre-authorizations or referrals. They are not required. We welcome independent contractors, individuals, companies, part-time employees, and anyone who has been on a COBRA insurance plan. Also, benefits are not tied to your employer. They are portable. It goes with you wherever you go. And lower maximum out-of-pocket expenses.
Sedera Health. We need to dig in a little deeper into Sedera Health. They've been around for the employer-employee relationship between Sedera and us has been going on since Sedera was built by their parent company, Karis, K-A-R-I-S, who's been around for 25 years. So Sedera does two things for our members. First of all, they negotiate all the medical bills with the providers, whether it's institutions or individual providers, and they get that accomplished very successfully, as I said a couple minutes ago, on reductions. Secondly, and most importantly, they are patient-centric, and we all care about the patient first and foremost. And give it as an example, they only get a fixed amount of percentage of the monthly membership in order to manage that whole organization of medical bills. And secondly, they're very judicious about how they do that. So let's say in the event there is a disagreement on whether a health need should be shared by the community, and it can't get resolved successfully between our member and Sedera and us. Sedera has a practice where they will create a 7-person panel of people who would be knowledgeable about the need in question. And if 2 of those 7 people vote to pay the need, they pay the need. I am unfamiliar with any business organization that would have that as a strategy, but that's all great. And that's why we say they're patient-centered. They really are patient-centered. The rates. If you can see the rates, there's a lot going on there. But what's happening with the big insurance companies today is they're reducing their monthly cost, but increasing the deductible. Just like Tim explained what happened to him at the opening of this webinar. So I'm talking to a nurse in out west, and she said, well, I'm looking at your website, and I have a family, I have a husband and 4 kids. I'm looking at your website, and you're expensive. And I said, what do you mean we're expensive? She said, well, I'm only paying $380 a month for my family. And I said, well, what's the deductible? She said $6,500. And I said, is that per person? And she said, yes. I said, ma'am, God forbid your family should be in an accident on the way to grandma's house. But your out-of-pocket exposure here is potentially almost $40,000. Your out-of-pocket exposure with our plan, the health share plan, is 5 events of $500 for your family for the whole year, which is $2,500. And the savings on your maximum out-of-pocket exposure is totally offset by our monthly sharing amounts, and you should sleep better knowing your total family exposure to us on a year is $2,500.
Okay. What the health share plan includes, this is what everybody wants to know. Preventative care is reimbursed at 130% times the Medicare rate
For the doctor.
for the physician. The health share plan contacts your physician to explain the program with a personal member advisor that you're given upon enrollment. Sharing of medical costs above the IUA. This is included while traveling in the United States and abroad. This is ideal if you're on vacation or you're on a business trip and have an accident or an illness. And everyone pretty much knows someone that this has happened to. 24/7 access to Teledoc. It's free telephone consultations with knowledgeable physicians, 24 hours a day, 7 days a week. So if you have something that, like a rash or something after hiking, you don't have to go through the trouble of finding a dermatologist for this. You can actually call Teledoc and speak to a physician over the phone. And they can even prescribe medication over the phone if need be. You have Second MD. This is required for elective surgery at no extra charge. And you are also given a $250 toward your IUA for going through the second opinion process. This is a telephone medical record review, so there's no traveling or paperwork necessary. And you get paid to exercise. Our members reduce medical costs through smart choices, such as diet and exercise and keeping a healthy lifestyle. We pay members $10 each month simply for participating in our study. It's a phone app, very simple to use, and it only asks for 5 simple questions. And then you get your money every quarter. So in summary, I can go over some more benefits. It's proven and affordable, 20 to 60% monthly savings. You can enroll at any time. Again, freedom from networks. We are 100% Affordable Care Act compliant. And we have preventative care reimbursement and the sharing while traveling, again, in the United States and abroad. So do we have any questions?
All right, I'll jump back in, Carrie. Sandy and Carrie, thank you so much for the great presentation and the information you shared. Now, a number of the questions that had been coming in during the presentation you actually have now answered, but there are a few here, if you don't mind, that I'll ask. So one of them involves how the whole prescription thing worked. And basically the question is, Can you help me understand how this program addresses prescription costs?
Excellent question. And actually comes up probably in the top 5 that we get on a daily basis. One of the things to go back, as you can tell from the presentation and mostly Carrie's comments, we have simplified healthcare down to manageable and understandable. You either have a wellness visit or you have an illness or an accident visit. And so along with trying to simplify the whole process, prescriptions are, we reimburse prescriptions that are curative. So in the event that you are for 4 months, in the event that you're in an accident or have an illness, we'll pay 100% the prescription for the first 4 months. If you have a previous prior condition and you basically need a drug prescription for the rest of your life, we will help you find the least expensive route to go. And believe it or not, Costco is a very good place to go for prescriptions, as is GoodRx, and most of you have seen those ads. Go ahead.
Can I just add to this answer? GoodRx is free to anyone, and we've done this, so I can explain. When my husband had the issue with the cardiology issue, they gave him for maintenance Crestor, which a lot of people are on, and we went to Walgreens. Walgreens for Crestor is $239 per month. We gave them the GoodRx card. They put it into the system so we don't have to give them the card anymore. And with GoodRx, I don't know exactly how that works with them, but what we had to pay was only $27. So we pay $27 a month for Crestor. So, and this is through Walgreens. So definitely the member can investigate where is the cheapest place to get the maintenance prescriptions that they need. And there are a lot of discount programs out there that are really helping out all of our members.
We also will tell people, if you have diabetes 1 and you are happy with the plan that you're on, stay where you are. Do not come over to us, because diabetes 1 is a complicated, serious, ongoing condition. And so not everybody should join us, but diabetes 1 is one where you want to stay where you are. So.
No, I appreciate that clarification, and that is really helpful on the prescription issue, because there are alternatives to some of the current cost pricing models that are out there for insurance companies. So I appreciate that information, Carrie, in particular. So here's another question that references the teledoc services. So in the presentation, you had mentioned 24/7 access to teledoc. Are these costs? Am I to understand these costs are included in the program?
Yes.
And go ahead. No, and they're all board certified physicians, and they relate to where you are. So you can tell a doc where you are, and they will give you a board certified physician in your neighborhood who understands the geography.
And you don't pay your IUA for this at all.
No.
So this is included, and it is free, and it is so. This is if you're a mother and you have young children, and they get all sorts of rashes and all sorts of things coming up, ear infections and everything else, and you don't want to drag your child, even if your child's 20, they're still your children, your child in the middle of the night to a physician or to an urgent care or to an ER, you can call them, speak to a board certified physician, ask them for advice, ask them what you should be doing. They can they will either diagnose, give you a prescription, call in a prescription for you if it's something very simple, or they will tell you, no, this is something that you need to go to an urgent care and an ER for. But at least you have that relationship with them. So it is really huge for children of all ages.
Yeah, that's great information. Thank you. So here, this looks like a process question. I think you answered part of this before, but the question is, without the usual insurance card that I'm used to showing to a doctor, how do I explain this program?
So this is exactly what we did. You go to a medical, a physician's office, and you say, of course they're going to ask you for your insurance card, and you say, I'm part of a sharing program, so I'm considered to you as a self-pay patient. Now, most doctors' offices have a separate charge for self-pay patients. It's actually less than what they should charge the insurance companies. And they'll tell you what it is, and you will pay only up to your initial IUA if it's the 500 or the 1,000. So a couple of things happen. They get very excited because you're actually paying for your visit right then and there. And two, they're more excited that they don't have to bill an insurance company. They don't have to deal with the paperwork and the phone calls with that. And also, when you do call for a follow-up appointment, they will bump you up and they'll put you in earlier because you're a no drama patient, if you would. It's easier to deal with us.
I like that. So this looks like it'll be the last questions. There's a couple other ones as I read. We've actually already answered. So the question, or the statement also on a question, they're saying all of our staff has seen large increases in both monthly premiums and our total out-of-pocket contribution. This plan sounds very attractive. So what's the next step for my staff to enroll in this type of program if they're interested?
We can do several things depending on the size and how many there are. If the office manager would like to send us the dates of birth, and how many are in the family, whether it be single, couple, parent, child, or family, we can give them a quote in about 20 minutes and compare with what they currently have. We only have one plan. It is a Gold Plus plan. So a lot of times you have to do the comparison. They say, well, my plan's cheaper than yours. But then the second consideration is, what kind of plan do you have? If you have a bronze plan, you don't have very much of anything that's of quality. Whereas our Gold Plus plan is only, everybody gets that, and then you've got the pricing that we went over previously. So.
Okay, perfect. So if it's just an individual or a number of individuals, they can go online and go through the enrollment process themselves. But it sounds like if there's a larger interest from a number of the members of the practice, then they should probably send an email or call and share that information to get a more formal quote.
Yes, and we don't care who pays the monthly bill. So if the physician practice wants to share or pay the bills on behalf of the employees, and then the employees pay for the families, that's fine. If there wants to be some kind of percentage of sharing, we don't care how that works. It works. So
okay.
Anything I'm sorry, I don't mean to interrupt. Anything that works for you will work for us. So if you want to call, you can ask your questions. You can email, because some family members may have some personal medical issues going on. They really don't want to tell their employer what's happening. They can contact us for specifics. So anything that really works for you to enroll, we're fine with, and we will go with.
No, that's very helpful, because I know a number of the groups we've spoken to already, and some of them that have joined, they appreciate that flexibility because they may want to structure it differently than they're doing now because they haven't had any real choice in the past. So this is wonderful. Well, with that concludes the webinar here, and we try to keep it to around 30 minutes, and hopefully this is information that will be helpful. We're hoping that you'll share this with your staff and physicians. Obviously, this is something that's an important decision. We would encourage more questions if you have them, or a phone call or a conference call. But again, you can send an email to PSMA Health Share Plan. I'm sorry, the website's psmahealthshareplan.com, where you'll have a landing page with a video and other information, including frequently asked questions. You can send an email to psmainsurance@usi.com with any questions or call the 855 number there, and we'll be glad to help you out however we can. Well, Tim, Sandy, Carrie, we certainly appreciate all the information and insight. This is really important for your member practices, and we look forward to hearing from many of them so we can help lower their costs and give them some stability in their health insurance program.